There is a famous quote by Dr. William Osley, founder of Johns Hopkins University. The trained nurses has become one of the greatest blessings of humanity, taking a place beside physician and priest. My name is Dr. Jahazeb Kamal and I am Director Medical Affairs, Pharmacovigilance and Clinical Trials at Getz Pharma. Today we are celebrating, commemorating and also educating the various aspects, common issues related to medication and medical usage of these medicines. And to do this, we are also aligned with the WHO slogan of no harm from medication. To have this dialogue continue, I'd like to introduce my expert, Dr. Abeer Salim Habib. Dr. Saba, how are you?
Thank you so much.
Thank you very much for joining us today. Today's topic is patient-centric care. What does it mean to you?
All right. Thank you so much for this question. It's actually a very vast question, but we're going to try and lock it up in a smaller piece for our audience. The sole purpose or reason for existence of healthcare establishments is the patient.
All right.
So any care that is provided, of course, should revolve around your patient. When it comes to patient-centric care, this is now a buzzword in today's healthcare. It has been for the past couple of years, and the way I see it, it's going to be the same for the next 2 decades, perhaps. There has been a lot of shift in the way that healthcare is looked upon. So, for example, the Hippocratic Oath, which is a more than 3,000-year-old document.
That's right.
Is what every physician has to, swear by at the time that they're being given their degree. So that document itself reflects that the healthcare was, the center of attention of entire healthcare used to be the physician.
Okay.
But that has shifted.
Mm-hmm.
The shift is a paradigm shift from from physician-centric care to patient-centric care.
All right.
अगर हम इसको एक lay terms में बात करने की कोशिश करें through an example.
Sure.
So the way I talk about it is that, there used to be a time when एक doctor साहब होते थे जिनको आप reach out करेंगे. The doctor साहब would come over to your home. He'd be wearing a black coat and carrying his steth around his neck. And there would be a bag जो आप लेके आते थे doctor साहब के लिए,
Yeah, बिल्कुल.
He would come in and examine your patient, assess them, give medication, sit and observe. So it was a very personalized sort of thing. However, it was all about the physician. Even if the physician would say, okay, I'm so sorry, the patient is no more. हम उसी इज्जत रिस्पेक्ट के साथ डॉक्टर साहब को उनके घर पे ड्रॉप करने के लिए जाते थे.
That's right.
Now that has all changed. Now it is all about your patient. Your patient will decide वो डॉक्टर शॉपिंग करेंगे. They will select the physician from various apps.
Yeah.
They will go to him. वो उनको rating देंगे perhaps.
बिल्कुल सही है.
And they would be the ones deciding कि उनके लिए क्या बेहतर है. पहले मैं डॉक्टर हूँ, मैं जानता हूँ वाली चीज़ को हम सब accept करते थे. Now we're like, okay, हम second opinion कहाँ ले सकते हैं? Are you sure about it? What's the outcome? Price क्या होगा? So all of those, अभी discussions open हैं, अभी decision making shared है.
All right.
And the Hippocratic document has also been now transitioned into something that's called the Doctor's Pledge.
Really?
This is a document which is developed by the World Medical Association. About 120 countries participated in the development of this one.
Okay.
And if you just compare these two, आप देखेंगे कि वो it is now all about the patient. Patient rights, जो पहले एक word ही नहीं था, exist नहीं करता था vocabulary में. It is now the most important thing around which every healthcare procedure, device, care is, revolving around.
All right. So that means that the patient is right in the middle now.
Yes.
And everything around it will support the patient benefit, right?
Yeah.
This what happened. There's so many different specialities in hospitals. The number of people have increased.
Yeah.
Those who are talking to patients. So don't you think that it has become very, very complex? At least one patient is talking to so many different people in a hospital. So how it's managed?
That is very true indeed. Again, वो पहले doctor, nurse and patient,
Yeah.
or sometimes just doctor
Yeah.
and patient.
Yeah.
That was the entire interaction. अब
Right.
you have all these different professionals. Doctors, हर एक speciality के लिए एक अलग kind of physician is available. You have to see them, even if so the मरीज is one,
Yeah.
but the care providers are various.
Many now. Yeah.
आपकी नर्सिंग की भी डिफरेंट टाइप्स हैं. यू हैव क्रिटिकल नॉन क्रिटिकल नर्सेज, यू हैव OBGYN स्पेशलिस्ट नर्सेज, फिजिकल थेरेपिस्ट आल्सो, यू नो,
Dietitians.
dietitians, rightly
Yeah.
said. So bilkul, so all of these are now interacting with your patient. So again देखिए इसमें ना there is this reminds me of a very good piece by Rumi, where it's a little poem where they're talking about, you know, there was a group of people who had never seen an elephant before. India की कोई एक tale है ये.
Yeah.
So all the people went into a room where apparently an elephant was kept. When they enter, they're holding their candles.
Yeah.
So there's one जो जाता है elephant के, you know, ear के पास.
Ear के पास.
And when they see it, they say, okay, it's a fan.
That's right.
The one at the tail says it's a rope. The
That's
one
right.
at its, पैरों के पास जो जाता है वो कहता है it's a pillar.
Yeah.
The one at the tusk says that it's a spear.
Right.
And they all have their own opinions, and then they come out and they argue. Then next day, सुबह में रोशनी में जब वो जाके देखते हैं, then they see the whole elephant.
Right. Right.
So healthcare also, patient centricity जब ही आएगी जब आप अपने ये अलग अलग छोटे छोटे domains को आपस में connect करेंगे, integrate करेंगे, and that is when you get to see the entire picture and become a holistic care provider for your patient. They
All
may
right.
have multidisciplinary issues, they may need all these experts, but cohesiveness is
Yeah.
what makes it patient-centric.
Right. So, do you think that हमारे hospitals में it becomes a little challenging because there's so much workload, there are so many patients? So, do you think this approach works well, or it's easy to do this?
Nothing is easy.
Yeah, right. That's true.
But if you do take that oath seriously, and if you are a quality organization who is focused on what is being done for your patient, तो फिर वो cohesiveness आ जाती है. And I think at this point I would like to give example of the institution where I work right now. We are working on this model. We have this cohesiveness. We have this integration. So all the care providers know कि आपस में हमें discussion भी करना है, because we're working for this one patient. Multidisciplinary issues, that's very common. तो वो आप कैसे achieve करेंगे, that depends on the core values that the institution carries.
That's great. Audience, with me today is Dr. Abeer Salim Habib. She is Assistant Medical Director at Tabba Heart Institute, Karachi. We are continuing this dialogue. Please stay in touch with us for now. Communication effective कैसे होती है मरीजों के साथ?
Thank you so much. This is a very good question, because you know that's all we do. Communication is all that we do. We are writing things down, we are verbalizing things, we are, you know, sending somebody to run across to another floor and bring something for us. ये सब communication है. Effective ये तब होगा जब आप उस patient को अपने साथ on board लेंगे. So the patient and family engagement is what empowers your patient and makes them a stakeholder. And when they are a part of it, तो वो आपके साथ साथ चलते हैं every step of the way, and it increases compliance as well. Whatever is being done in the hospital is one thing, but अगर आपको अच्छे health outcomes चाहिए, आप चाहते हैं आपका मरीज वो medication timely ले, वो test timely करवाए जो आपने advise किए हैं, you have to make them a part of your team. जिस तरह आपके बाकी हेल्थ केयर प्रोवाइडर्स हैं उसी तरह आपका मरीज है, equally important.
और इस इंटायर कम्युनिकेशन में जो फैमिली केयर टेकर्स होते हैं, how much value is given to these stakeholders?
Again, something where we are very different from the more developed parts of the world.
That's right.
वहाँ individualistic approach है.
Yeah.
It's a doctor-patient interaction only. But in Pakistan, we have a collectivistic culture. So it's never just the patient and the healthcare provider. It's always, a number of people जो उनके साथ में होते हैं. and you can engage them as well. But you have to identify एक primary attendant, next of kin, legal guardian, उनको आप on board ले लें.
Okay.
Because the patient may or may not be awake or conscious throughout the course of the treatment. So that is your primary stakeholder जो आपके साथ में buddy in हो जाता है. And they're the ones who would teach you about the patient and who would also teach the patient about what needs to be done.
Right. What is high alert medications, and what need to be communicated to the physicians and also to the patients?
Okay, thank you so much. That's a very important question. HAM or Lasara? High alert medication, look-alike, sound-alike, read-alike medications. देखिए मेडिकेशन तो कोई भी हो, वेदर इट्स समथिंग जो पेशेंट अपने घर पे जाके खुद से लेंगे या फिर द वन दैट यू गिविंग एट द हेल्थ केयर फैसिलिटी, सब में ही हमें केयर करने की नीड है. यू हैव टू चेक थिंग्स, देयर आर राइट्स ऑफ मेडिकेशंस, वो सब आपको फॉलो करने हैं. व्हेन इट कम्स टू दीज हाई अलर्ट, ये लेबल इसलिए है एज हाई अलर्ट बिकॉज इफ समथिंग गोज रॉन्ग the consequences are severe. तो इनके लिए mechanisms exist करते हैं, दुनिया भर में हैं, पाकिस्तान में भी हैं. Those mechanisms include what? From the point of the medication being prescribed by your care provider to the point जब वो pharmacy से communicate हो, pharmacy उसको ready करे, prepare करे, dispense करे, somebody is carrying it to the patient and then somebody double checks before it is administered.
Okay.
उसकी storage, उसकी tagging, flagging, all of this needs to be done just to make sure that आपका patient जिस चीज़ के लिए आपके पास आया है वो उसका treatment करवा के healthy होके वापस जाए, ना कि हम उसको एक added harm करें.
सही.
So this is neither a part of his treatment nor the disease. This is something जो हम खुद कर रहे हैं ना उसके साथ.
Right.
So you gotta be very, very careful.
So you treat these drugs very, very differently. They're not on the normal routine process.
No. They're not even in the same shelf as the other medications. उसको separate रखते हैं. उसके the bins where we keep them in the pharmacy are different color के साथ होते हैं. वो उसकी labeling अलग होती है so that you can't just accidentally pick that up.
Okay, that's great. So we have seen many times that many doctors are working in hospitals and patients that are coming to the hospital or their attendants, they get infected. So with the workload that we have in Pakistan, a lot of patients coming in, walking to the OPDs and inpatients. So how this is managed in your hospital? What your experience have been so far with this?
Okay. Yeah, again, a very interesting and very important question. I think the pandemic that all of us have been through and survived has taught us a lot about infection prevention and control. I don't think I'm the subject expert, but I learned so much as we went through that pandemic. Again, देखिए ये जो World Patient Safety Day का जो topic है ना, it's patient engagement. Patient engagement जब होगी, जब patient empowerment होगी. Your patient can actually ask you, have you washed your hands? And that in itself is a very big reminder about how you've designed your infection prevention and control practices. So at Tabba Heart Institute, we have a very strong team of infection prevention and control, and उनके दोनों काम हैं. वो पेशेंट की बेडसाइड पे जाके भी इवैल्यूएट करते हैं, समथिंग एज सिंपल एज अ कैन्युला, उसमें भी फ्लेबाइटिस तो नहीं डेवलप हो रहा, to all these patient setting की चीज़ें. And then we also have a mechanism to check how the care providers are handling things to make sure that we don't give any infection to our patient. जो hospital acquired infections होते हैं जो बहुत common है in our part of the world, उसको prevent करने के लिए, so there's education, teaching, sessions arrange करके in a classroom setting भी आप सिखाएं, but then also you go at the workstation and you teach them there and then. Your consultants are pretty much trained on it. Practices आपको देखनी होती हैं, and the juniors are the ones जहाँ पे आप effort करते हो so that they grow into professionals who will not make the mistakes.
Patient have high risk of fall. Do they require certain different arrangements in a hospital where you can avoid these risks of fall?
Yeah. So sentinel event कहलाता है अगर ये patient आपके पास admit हुआ है for whatever reason and they suffer a fall. So this is known identified never event.
Okay.
JCIA and NHS, ये
Yeah.
दोनों bodies ने इसको declare किया है as a never event. It should never, never, ever happen.
Okay.
But they're still reported.
Yeah.
So, of course, there are mechanisms in place. This can include something as simple as a band. जिस तरह patient अपना ID band हम उसको पहनाते हैं, that patient का name ये है, medical record number ये है, blood group whatever. उसके साथ में there's another band which is differently colored so that you can tell. या फिर आप उसके bedside पे भी एक label लगा सकते हैं. Your nurses have to be trained कि every time they move away from the patient वो bed की railing को ऊपर करेंगे. अगर वो पेशेंट को कोई ऐसी मेडिकेशन मिली है या उनकी क्लिनिकल कंडीशन ऐसी है कि वो खुद से उठ के दे कांट इवन गो टू द वॉशरूम बाय देमसेल्व्स, तो समबडी हैज़ टू बी देयर टू टेक केयर ऑफ देम. सो ये छोटे छोटे स्टेप्स हैं जिससे हम इस चीज़ को प्रिवेंट कर सकते हैं.
तो बहुत छोटे स्टेप्स हैं, ये आराम से हो जाता है.
वेरी डूएबल. यू डोंट नीड, इसके लिए आपको कोई एक्सपेंसिव मैकेनिज्म इन प्लेस करने की ज़रूरत नहीं है. दिस इज़ वेरी इजीली डूएबल by your existing healthcare force. You don't need additional resource for it. You don't need a lot of money for it. It's fairly simple.
It's more educational rather than resource intense. nahi. It's more educating the caretakers on this.
And compliance also. Compliance also. If it does happen, usko agar aap timely report karen to your hospital authorities, so there can be strategies in place. अच्छी तो प्रोएक्टिव अप्रोच होती है, बट आई से दैट इन अ सेटिंग लाइक पाकिस्तान अगर हम उसको आइडेंटिफाई करके रिपोर्ट भी कर दें तो नेक्स्ट टाइम रिएक्टिवली आप उसको फिर प्रिवेंट कर लेंगे.
राइट. Accreditations, global accreditation, JCI and other accreditation, they also recommend taking feedbacks and surveys from the patients. Do you think it happens? In Pakistan at least.
Yeah, at many hospitals it does happen. At some perhaps it doesn't. I mean, even if there is a feedback, usko shayad the circle doesn't close. The cycle loop jo hai wo shayad incomplete reh jata hai.
Outcome jo hai wo probably
in many hospitals
outcome जो administration तक नहीं पहुंचता या change में नहीं आता.
But as far as my institution goes, Tabba Heart Institute, we have a very strong patient feedback mechanism in place, and there are various methods जिससे हम ये कर रहे हैं. So day to day bedside पे जाके we have patient relation officers who go in and who seek feedback from our patients. They have a very smart tool जिसके ऊपर वो feedback ले रहे होते हैं. Then we have all these, we have a policy in place कि discharge जब patient हो रहा होगा, so they'll be given a feedback form or a card जिसको वो fill करते हैं, and we assist them in filling it. And then we have a software system जो designed है, whatever area का feedback वहाँ से आता है, relevant authority को वो we send it ahead, we get their response on it, and if there's something which we can do to improve, तो वो हम करते हैं. वैसे a lot of times it is appreciation.
Okay.
So that morale boost होता है. Healthcare professional इतना effort कर रहा है, if they get good feedback, it really helps.
Right. Thank you very much for the great dialogue. Now I can understand what does patient-centric care means. Yeah. Any message you want to give to the audience, to the doctors or HCPs or patients, please?
So, keeping in consideration जो हमारा agenda है for World Patient Safety Day, I think it goes without saying कि whatever is being done for the patient, उसमें सिर्फ एक चीज़ है that can bring a paramount difference. और वो ये होगा कि you put yourself in those shoes.
Right.
अगर आप ये समझते हैं जिस तरह की आप केयर प्रोवाइड करें, अगर आप हेल्थ केयर प्रोफेशनल हैं, वट एवर डिसिप्लिन, आप डॉक्टर हैं, आप नर्स हैं, आप थेरेपिस्ट हैं, वट एवर यू आर, if you would treat your own loved one like that, or if you were placed in that position, आप चाहेंगे कि इस तरह आपको ट्रीट किया जाए, then carry forward. If not, change yourself.
All right.
So that's the one thing जो बहुत बहुत बड़ा change लेके आ सकती है.
All right. Thank you very much. Audience, today we had a very good dialogue with Dr. Abeer Salim Habib, Assistant Medical Director at Tabba Heart Institute, Karachi. The topic was also very, very interesting and important. It was related to patient-centric care in hospital setting and what we have to do in order to accomplish patient satisfaction levels. Thank you very much and stay tuned for our next episode.